welcome to the Go to Physio Sports Massage series. What I want to do in this series is give you some actionable content that you can get results. I want you to save your hands, I want you to protect your body while still being able to make changes to the nervous system. Now, before we get into the content, I want you to be aware of some important things. Sports massage is great. We're probably not breaking up scar tissue. We're probably not, doing all these crazy things, but what we are doing is we're influencing the nervous system. Now, before I show you all my favorite techniques that I've used in pro sport and in the clinic here, I want you to be aware that with hands-on treatment comes great responsibility, okay? You as a therapist need to understand the 80-20 rule, the Go to Physio 80-20 rule, which states that we spend 20% of our time and attention on the symptoms, and that's a lot of the stuff that you're going to be getting in this free sports massage course. So the symptoms, okay, that we're teaching, okay, that we're desensitizing, we still need to make sure that we spend 80% of our attention on the true cause. So if we've got someone with knee pain, for instance, and we think their quads are tight, or they've got a reduced range of motion at that, maybe they're sensitized, the tissues around the knee joint are sensitized, and we want to desensitize with some sports massage techniques, then we obviously do that. But then straight after, we want to spend the rest of the time giving a graded exposure program to the tissues that aren't doing their job. Maybe in this case, the gastro, the hamstring, and the hip, like we've covered in a lot of our other series, okay? So please, please, please use these hands-on massage techniques with good responsibility. I was a little bit nervous about putting these out there, but I think I want to help as many therapists as I can become that go-to therapist. But please just understand, if you're doing this stuff, your patient walks out the door feeling good and the pain comes back again, you haven't addressed the true cause of the problem. We're just treating the symptoms, we're just desensitizing the symptoms. If you want to know more of that, head over to thegotophysio.com, and I've got plenty of resources there for you, okay? But with that said, I hope you enjoy the course. The techniques I'm going to show you, they're the techniques I've used on world-class athletes, non-sporting patients. It's all about getting the right pressures. You can use these whether you're female, male, whether you're tall, whether you're small. It's all about just getting the right pressures, the right depths, and obviously retesting then straight after. With that said, let's get into the content. I hope you enjoy it. I'll see you on the other side. So now we're going to cover the essentials of soft tissue. Okay, now when I was a student, my soft tissue massage practicals actually consisted of us doing, I think it was about 2 days, maybe 2 hour-long sessions, and we were using talcum powder, and it was very, very kind of neurologically based, okay? The realities is with sports massage, there's a lot of people teaching courses and they're doing this and this and this, whereas the reality is we don't necessarily need to have a massive host of specific techniques. You're going to need 1 or 2 different techniques that can be effective to bring about a change in the tissue. Now, we are going to have a separate actual lecture on this, but the key thing to understand is we're probably not changing a massive amount of the physical structures of the tissue when we're massaging, but what we are doing is we're bringing about some kind of modulation, whether that's a change in the tone of the tissue, and then we're getting the benefits in terms of increased range of movement, decreased pain, increased confidence when the athlete moves, etc. Okay, so the first thing before we actually treat the athlete is you want to have some kind of objective assessment that you're going after, okay, whether that's a generic knee flexion test that you're trying to influence, or whether it's a painful symptom that we're trying to alter the pain experience, etc. So then when you do your treatment, you then have a retest that we can go after straight away.